This slide actually shows the results of Sweden's corona strategy versus Scandinavia. I've also inserted UK here because a lot of people know that UK has had lots of lockdowns and lots of problems, so how are they doing compared with Scandinavia and Sweden? Well, in order to really understand what's going on in Scandinavia, you also have to look at the population density. Our health authority in Sweden would like Sweden to be compared with countries like UK, Belgium, Netherlands. But the problem there is Sweden has a population density of only 25 people per square kilometre. UK has 281 people per square kilometre, so more than 10 times higher population density. And the countries that Sweden wants us compared with are the ones that have this very high population density, between 10 and 20 times higher than Sweden. It means that keeping a distance is much harder in these countries. A lot of people are living in crowded conditions, and it's impossible to maintain the sort of distance that you can in a country like Sweden. Well, what about Denmark then? Well, they also have a very high population density compared with Sweden. They're more than 5 times higher than our population density. So you would expect Denmark to be having a lot more problems than Sweden. We have Norway and Finland at 15 and 18 people per square kilometers. So they're very similar to us. So it is true that Sweden should more regularly be compared with Norway and Finland, much more regularly than it should with Denmark, and almost never with UK, because we have such different demographics. A lot of our things in between our countries are different. So what's actually been happening then? Well, if we look at the daily confirmed cases, I think in the beginning, and the reason that I also included UK here was, in the beginning, UK and Sweden were wanting to go for a herd immunity strategy. They didn't really want to test because they didn't really want to know very much about how large the spread was. So in the beginning, UK and Sweden were not testing very much. So it looks like we had almost no spread in the beginning. But then if you look at how many people were dying, we had an enormous death rate, both for UK and Sweden. We've got UK here and Sweden here. So when we weren't testing, this was actually having enormous consequences for our country, because we were having a lot of deaths, but it looked like we didn't have a lot of COVID. The problem that we had here is that the investigations that our health authority did about schools and about the risks to teachers were in this period when Sweden was not testing. Sweden wasn't testing sick children in school. Finland was testing. You can see their curve here. And their curve of testing is very similar to their curve of death rate. So Finland was testing every sick child, whereas Sweden wasn't testing any children unless they were admitted to hospital. So any reports that you take here in the first half of 2020, all the way to July, August, are totally immaterial. You can't compare Sweden with another country at this point because Sweden was not testing people. Then we can see that the government decided in the June 2020, we have to start obeying what the World Health Organization is saying. We need to start testing. As soon as we started testing, our case levels went through the roof. Up and down. We had a little bit of a drop here. And then as soon as term started again, no preventative measures in school. So we started to get a massive spread. And this is what Salminen, the health authority for Finland, he warned Sweden about. Keeping schools open means that we actually are risking 10% of our pensioners. And that's why they initially closed schools, because they didn't want to see this effect. As soon as schools open, the spread is major. When we get a high level of spread, we also see that we get a high number of deaths. By December, January 2021, we had better methods of treating the illness. We were getting fewer people dying, but when you get a high spread, you're going to also be getting a lot of deaths. You can see here that it's only Denmark really that's even following the UK and Sweden's curve. Denmark is still way below Sweden, but the countries with similar population densities to us, the number of deaths they're having is almost negligible. They are 1 death per million people. So the countries with similar population densities to Sweden are actually almost negligible on the death scale. What's happening now then? the last couple of months, well, Sweden actually stopped allowing vaccinated people to get tested. And this has created that it looks again like we almost have no cases. And it's very difficult to follow the statistics because the deaths usually come a little bit later. But now when the new variant has come and is starting to spread, and Delta seems to be getting much more contagious in the whole of Europe, we're seeing this exponential growth coming in Sweden, Finland, Norway, Denmark, and the United Kingdom, and basically all countries. We're going exponentially straight up now. So even though a lot of our population is vaccinated, 67% of the Swedish population, we are still getting a lot of problems with the explosion that's happening in Europe is also going to affect Sweden, even though our health authority is telling us that that explosion will not happen in Sweden. They still keep trying to sell us the fact that we will be better off because we have had more deaths already in Sweden. And that was actually one of the headlines last week. 15,000 deaths might have helped prevent Sweden from getting the fourth wave now. I don't think it really looks like it's going to prevent it. And anywhere, well, we killed a lot of people, so hopefully not so many of us are going to die now. To me, it's an unethical and immoral thing to say.